I'm Dr. Heather Richardson. I'm at Bedford Breast Center, and I'm a general surgeon that primarily treats breast cancer. However, one of the things that I actually really take a lot of enjoyment in doing is putting in a port. So what is a port? An example of a port is this little guy right here. Basically, all ports have a soft, flexible tube that dives into the bloodstream, usually through a vein that's either here in the neck or underneath the collarbone. It can be on either side. And then attached to that little soft, flexible tube is a bubble that has a self-sealing membrane so that when it's underneath the skin and you're ready for a chemo infusion or blood labs, a nurse can put a needle into the bubble and have access to your bloodstream. When patients need a port, they often turn to an interventional radiologist or a surgeon to put the port in. Now, the easiest thing to do for the doctor is to make a small incision close to where these veins are and then slip the little port bubble underneath the skin. That's all well and good for the doctor, and it certainly makes a functional port, but the downside of that process is it means that you usually have a large scar, anywhere from 1 to 2 inches. Over time, I realized it's just as easy to make the insertion site for the port actually in the armpit. We make a small incision while the patient's asleep, and then from beneath, we create a little small tract where we can slide the bubble underneath where it needs to sit at the top of the chest in this area, but yet there's no scar. The other really nice thing about that is sometimes if we make an incision right here and slip it right through that incision close to where the blood vessels are in the neck and under the collarbone, sometimes there's just a very thin layer of skin over top of that area, which can be uncomfortable, tender, and actually sometimes people will have the port push its way through the skin. It'll actually wear itself through. One of the advantages of putting in from a little bit further away is that when we slide it underneath, there's a lot more soft tissue to cover up the port, which makes it more comfortable, more covered, and more protected.
I went to the hospital for my first infusion, and I showed the doctor who was helping me that day, and she literally called over like 4 or 5 other nurses just to see that I had a port and I had no scar and that no one could see it, and everyone freaked out and we kind of celebrated together. I've showed it to numerous doctors and they all are just like so impressed by the fact that Dr. Richardson was able to put it in and have you not be able to see it, and so it's pretty exciting.